Hey everyone, this is Dr. Jonathan Streit with the Institute for Restorative Health, bringing you more information to help you reclaim, restore, and renew your health. Today's topic is chronic Lyme disease, and is it real? The important thing to note is this is for informational purposes only, education only. This is not in substitution of your medical advice. I like to define a few terms: acute versus chronic. In the world of medicine, we look at acute as being anything from 0 to 14 days. This is anything from a fractured ankle or an injury like that, or from an infection such as Lyme disease is. When you look at 0 to 14 days, that's the acute cycle. After 14 days, it goes to an area called subacute. But more importantly, we're going to talk about 6 months or longer, and that's that term chronic. Now that's a very important aspect for a lot of our patients because you want to be heard. You want some validity behind what it is that you're suffering with. And a lot of people feel that chronic Lyme disease as a diagnosis would give them a sense of validity of what it is that they have, has a meaning to it. In the medical world, they have created a definition known as post-treatment Lyme disease syndrome. Now, I feel a little bit off by this particular diagnosis. I'm not a big fan of the word syndrome because it can mean a couple different things. I hope in traditional medicine they look at syndrome as being what it means is a combination of symptoms that come around a specific pathogen or a specific cause. Namely, if it's Lyme disease, it's symptoms associated with Lyme make it a syndrome. But there's another definition in the world of syndrome, and that is a common belief and emotion around something as well. So they play with that word a little bit too cavalier. I like to define that, and I would like them to define it as well. Why is it in medicine do we have a hard time diagnosing chronic Lyme disease or even post-treatment Lyme disease syndrome? Well, there's 4 main factors that are at play here. One is you had to have had a diagnosis of Lyme disease, and now this is typically in that acute phase. So you had to go out, get infected, pull the tick off, have all the symptoms that you would have in the world of Lyme, and then go to the doctor and get diagnosed with Lyme disease. At that point, you would have to go on a minimum of 4 weeks of antibiotic therapy. After that, all your symptoms had to go away. And then after that, within 6 months, all your symptoms have to come back. So to recap that, you get infected, you get diagnosed, you get treated, everything goes away, and then everything comes back. That is how they would diagnose you with post-treatment Lyme disease syndrome. I kind of don't like that, and there's some reasons why, and let me go through those with you. In conventional medicine, in order to be diagnosed with Lyme disease, specifically Lyme disease, you have to have positive antibodies on a specific array of tests. Now, an antibody is something that your body will create if it's exposed to this bacteria of Borrelia burgdorferi. Now, I've seen tons of these results before, and I've seen anything from almost all of them. There's about, I want to say, close to 30 different antibodies that they're being tested, and different weights for those, not different antibodies, but different weights of antibodies. And you'll see that the CDC only allows for a very select few of those antibodies to be present in order for Lyme disease to be diagnosed via the CDC's criteria. I have seen so many people in my clinic that have been decimated by this particular disease, and they have bans on every one except for the ones of the CDC criteria, and nobody knows what they have. I find some problems with that. When we look at chronic Lyme disease, and people ask us, so is chronic Lyme real? Absolutely it's real. The problem is it's here to stay. And unless we get behind a movement that helps people understand this illness instead of just trying to name it, we're not going to get anywhere with it. So I want to be a part of that change. And here at the Institute for Restorative Health, we are leading that change in how people are treated with chronic Lyme or other chronic illness conditions. Let's look beyond the diagnosis. What is it that you want? If you or a loved one is suffering from a chronic illness, ask that question. What do you want? Do you want a diagnosis? Do you want a treatment plan? In most people's cases, they just want to be heard. They want to feel that someone cares about them. They want to be treated like a person, not a diagnosis. So here at the Institute for Restorative Health, we treat you with compassion. We support you. We're complementary in medicine, but we're not in medicine. And we're here to help you pave the way to get to your end destination, which is really what? It's to be healthy again, to get back to your life, to be able to do the things you want to do that you've missed out on for so long. Let us help you with that. I know today's topic was pretty short, but I wanted to give you some insight in the way we look at chronic Lyme disease and what we can do for you by not looking at you through the lens of a test or the lens of a diagnosis, but the human lens. And how important is that? If you liked this talk today, please subscribe and like, because when you do that and you share it with other people, we can get this news out to more and more. And that's all I have today. Be blessed and be well.